Thank you for inviting me. I don't promise I'm going to make up the time because I have half the presentation. You're only giving me 10 minutes. That's not enough. I have quite a few slides to talk about. So this is my affiliation. So I am the president of Pharmacists Without Borders Canada. I am a surveyor with Accreditation Canada for the last 13 years. I'm a council member of the Ontario College of Pharmacists. I'm a director of pharmacy at CHIO. I am the project officer for Pictogram to Label Drugs for the International Pharmaceutical Federation. And of course, who's not a member of the Canadian Society of Adult Pharmacists? Sure, pharmacists. Conflict of interest. I don't think I have any conflict of interest per se, but I want to give you the source of funding of some of my project. So MedBuy has been giving me some money. The International Pharmaceutical Federation is giving me some money to some of my projects on pictograms to label drugs. And I get a small funding, non-restricted grant from Takeda. So some form of conflict, but Jensen, whoever else sponsored us today, no big deal. A picture is worth 10,000 words or 1,000 words. It's a fraud. It's basically, it was created by a marketing company in the US to sell baking soda. Still, the concept is pretty good, though. It's a very good concept. And today, what we're going to talk about is give you a quick overview about literacy, health literacy, medication literacy, which gives you some background and some Canadian data about this one, to explain why is it that our patients don't do what we ask them to do. Because we know very well that we have the science, give it to the hand of patient, and doesn't make it all the way up to the therapeutic outcome that we assign. And I will give you a brief overview of medication literacy tool and talk about my research interest, which is using pictogram or infographic, and how to develop them to provide patient education, and some of the projects we have done. Did you know that 3 out of 5 Canadian adults do not have the health literacy level to be able to manage their own health? That's a significant amount. And the older you are, the less likely you are to be able to manage your own health and have health literacy. So there's a significant problem that's underestimated when you provide clinical care. This is the different definition, how they fit in together. So literacy is very global. Within the literacy, you have health literacy, and then you have medication literacy within health literacy. And to compose all these elements, you have computer, numeracy, visual literacy, cultural, and media literacy. So to be able to function in society today, you have to be literate, which is basically the definition. You need to have all these different skills to be able to function to your full potential. Here's the official definition of health officer of literacy. And there's a huge difference between analphabet and being literate. Analphabet is unable to read because you haven't learned how to read. To be illiterate is someone that went to school to learn how to read but unable to comprehend the text to be able to function in society. There is 5 levels of literacy that have been established, and there's a different score, and the score is not important. I'll give you the most important element is level 3, is the level to be able to function in society. You guys should be level 5, because we write papers very long with big words and big things, so we should be level 5. But society, that's a level 3. When you look at the number of people that are below level 3 in the Canadian public, you look at the 2 slides, 16 to 65 years of age, have different elements, about between 40 and 50% are below the level 3. Means that you give them simple tasks and unable to do it by reading or by comprehending the text for prose and doing some basic calculation. Is there any nurses in the room here? Sometimes nurses have problems with numeracy as well, but hey, don't shoot at me. And of course, you get elderly because of health issues, then you can also, the number goes up. Health literacy is the same concept, but the concept is the ability to manage your own health. So what are the skills that you require to manage your own health, to make good lifestyle decisions? And actually, we were lucky in Canada, there was there's data per postal code about the level of health literacy in different part of in every city in Ottawa. Sorry, every city in Canada. And I know in Ottawa, it's MacArthur Street has the lowest level of health literacy in Vanier, and it's a very poor neighborhood. And the other place is a nursing home with the average age of 80 years old, so the lowest level of health literacy. But you can have this. So health literacy composes of this other element, which is in my DAISY earlier. How to test for health literacy. There's 3 tests that are used, and there's a test for functional health literacy in adults. It requires 22 minutes of time to do this test, almost never used in study. There is the rapid estimate of adult life literacy in medicine, which is basically give them a series of words. There's one for teenagers, there's one for adults. And if they're able to pronunciate the word properly, then they give them certain level of literacy. By the way, in Ottawa, our teenagers and our adults do very well as far as health literacy in the waiting rooms. There's a newer fancy one, which I haven't used in clinical practice yet, nor in clinical studies, where you give them basically nutritional fact, and you ask them 6 questions about this to calculate the number of calories that you intake if you take half a cup of or 80 grams of that food. So you really test the capacity to test numeracy and also the reading capacity. So why do we care about health literacy? If you have poor health literacy, so level 1 or 2, you're 2.9 times more likely to have poor health and poor health outcome as well. Poor income support and not involved in your community. So this is like the determinant of health altogether again. Just one, there's many data about the impact of poor health literacy in the parents or in children. I just want to present this one from Netherlands. Actually, Netherlands is very popular today, where they did compare a patient with poor health literacy and with good literacy. There's significant difference in outcome in the patient's management of asthma. This is just one example to give you the importance of this in pediatric population. Similar type of graph, but it's looking at level of health literacy and the incidence of type 2 diabetes. So the less literate you are, the more likely you are to be sick. That's a well-known fact. Same thing for high blood pressure. Here you have the other different determinant of health as far as health literacy is concerned. So if you're not speaking one of the official language, more likely to have poor health literacy. If you're older, if you a First Nation, if you're French speaking in a minority, like a French speaking in Ontario have very low health literacy because of the environment. If you're an English speaking in Quebec, it's not the same case. So there's a disparity with the French speaking, and I can talk about this. And even if you look at the average health literacy in the parents group, it's not that high either. So give you the determinant of health, very similar. If you're poor, if you're unemployed, more likely to be have poor health literacy. Why it's important? Because of course, if you don't have good health literacy, they will not understand how to manage a disease. And now let's bring the concept of medication literacy. So again, it's within health literacy, but it's focusing at what do you need to do to better manage your medications. And manage as far as calculations that you need to be able to make to calculate the dose that you need to take. Think about a patient with type 1 diabetes on insulin, and they can look at how much food intake and how much insulin they have to take. Think how about to use pharmacy services as well. How frequently you hear of a teenager that got a prescription for birth control pills with refills and did not understand that you had to go back to pharmacy to get the refills. I mean, that's story that really happens. It's not something that out of the blues. So there is 3 official definitions. I will not read them because you can look at them when you get my slide deck. But this is a new concept, how to best use pharmacy services and how to best manage your medications. Same concept, if you don't know how to manage your medication, you will have poor outcome. I will just skip this one. So the risk factor, you have poor medication or health literacy. And when you look at a patient, the most secretive thing they have in their life is the fact they don't know how to read, or they have poor reading capacity, or they cannot manage. So you need to find some idea how to identify these patients. One of them is if they want to fill up form. That's a trigger, basically. If they miss appointment, they don't know how to come to follow-up. It's not triggering on poor literacy. They describe the medication by color and not for the use, and don't know the name of these medications. They just know the white pill, the yellow pill. They smile a lot when you talk. They're very respectful, and they will ask almost no questions. And if you look at this from a clinical perspective, the more educated people that go on the website to read stuff will ask you tons of questions. The low educated people will never ask you any questions. They don't want to be embarrassed. They don't want to be discovered. They don't know about this thing. So we recommend a universal approach to these patients. So you cannot tell, even if they're well-dressed people, that if they're illiterate or not. So therefore, you need to have a global approach, come up with simple material. It would be interesting to look at the website where they have patient information, the readability level of this one. And it has to be focused. And actually, there's some guidelines. The information has to be accurate, accessible, and actionable. It has to be clear. There are different tools that have been used, and I will go over some of them, but use plain language. Ask me 3. So basically 3 questions you ask the patient to encourage them to ask you in their own world. Give them oral or validated graphic, and I will talk more about my study about validated graphic. Ask questions, ask them to ask questions. Teach back method as well. All different techniques has been used to deal with poor literacy or literacy issue. So plain language. It's been shown that if you write material at a grade 7, you're 4 times more likely to misunderstand it. And if you have ever written patient education material, I suppose at grade 5. To write at a level of grade 5 is extremely difficult. And on top of it, most of the tools to assess the readability are different from one. You have to try, you have about 3 tools to figure out what the readability level of a text is. And it's very, very difficult. I'll give you another example of a plain language. This is something that we will write as good healthcare providers. If you get exposed, basically, when children are exposed to high level of lead while they're playing in when playing high lead salt, poisoning can occur. It's true, it's very correct. So the simple way of doing this is that while playing in dirt with high level of lead can become sick from lead poisoning. Same information, much more easier to read at that point. So this is what you have to do when you provide your patient information. Lesson 3, ask the patient to ask you to encourage them to ask this question regularly. What's my health problems? What do I need to do? Why do I need to do this? And get them to say it. Don't tell it to them. Just ask them to ask the questions over it. The pictogram, which is my area of pharmacy practice research, they have to be clear, they have to be uncluttered, they have to be population specific, the style has to be consistent, and the body language needs to be accurate as well. And by the way, the data shows that pictogram designed by healthcare providers are not efficient. They don't tell the information, and I can tell you from the study I've done, pretty much accurate. And I'll give you some example of action plan, how we use this pictogram in real practice. So again, pictograms have been shown to be effective to provide medication information or also complex medical information. They also improve recall. It's based on a Pavlov theory that if you see an image and there's a text and you read that text, it's called dual coding. 2 parts of your brain seems to be functioning together and you're more likely to remember as just reading a text or just looking at an image. And this is how we teach children how to read as well. Give them an image and the word and they can see the horse and they see how to ride the horse. Same concept. And this concept of using pictogram, if you know Microsoft, you use your cell phone, it's all full of pictograms. So this is not a new concept. It's an old concept and the society is going that way. So the process to build pictogram over time, that's what we have developed. We start with a semiotic analysis of key concerning point. You design your pictogram based on this. You do initial testing and transparency and translucency. I'll explain this in a few seconds. You do short-term recall or long-term recall, and then you redesign your pictogram based on what you find out. What is semiotic analysis? Semiotic analysis is the study of signs and symptoms in medicine. And semiotic of graphic is the key graphic element that are required to support an image. So what is it that is in this drawing that communicate the information we want to communicate? So we use 3 different techniques. The latest one for the anaphylaxis action plan, we use a Google image. Google image has an algorithm in the system to give you the best image that represents one concept. So we use Google image. We use 20 on average. We look at the key graphic elements. And from this, we ask the graphic designer to draw us the graphic that represents what we want to see. We use a preferred image approach. We went on the internet, shake well before use. We took about 10 to 15 images that represent that, showed them to a bunch of teenagers and asked them which one do you think are the best. We took the best 3 the top 3 for shake well. We looked at the graphic element and so we designed it based on what the people preferred the most. It's another technique that we tested at my hospital. The other one, which I did a few years back, is asking asthma patients to draw how they feel when they have an asthma attack and how they feel when they don't have an asthma attack. And the concept of having an elephant on your chest, none of the children, I think we had 20 or 30 children that drew this, nobody came up with that elephant on your chest or big elastic band over the chest. So that concept is very good for us, the healthcare providers. This is an example of when we did coughing and using the Google image of the key graphic element that we looked at, that we told the designer, the graphic designer, this is what we need in this image. Open mouth, we needed the word eyebrows, closed eyes, leaning forward, bad under the eyes, and tight eyes. So it's completely different approach to do a design of graphics. Then the initial testing, we do transparency and we do translucency. Transparency is basically you show the image in the context. This is in the patient population you want to use it in. The asthma one, we use asthma patient in the emergency department. They were being seen for asthma. As in the context of an asthma or a management of asthma, what do you think that image means? It's called transparency and guessability. And that there's 3 levels. It could be correct, partially correct, incorrect, or critically incorrect. It means that what they're guessing is very dangerous. Translucency, after we have done this, we ask them, we do all the testing, and then we ask them, this image represents coughing. Is it a good image from 0 to 7, and from 1 to 7? That was the original article that came up with that scale, not me. And then it has to be above 5 to be a good image. So it needs to be and guessability above 67% if you use the ISO standard, or 85% if you use the NC standards. And it needs to be a translucency score of above 5 out of 7 to be a good image. What we've done is we added the distraction because, again, we want to know how much they can retain the information. We did 2 studies. One of them in young adults that were learning how to read, and they were mainly French speaking. And we did it also, which was long-term recall, tested the pictogram on them, came up with the guessability, and then a month later we went back and we tested them again, the same people. I can tell you that in this group of people, the guessability for the people with low literacy level was about 30%. It went up about 50%. The people with high literacy, so there's a different level of education, was about 80% to start with, and went up by 10%. Yes, even in this teaching them, then a lot of work needs to be done to make sure they understand. And redesign, because sometimes this is a project we did in the elderly for an empty stomach, and the guessability score was 24%, the translucency